From the Toronto Star, I'm Raju Mudder, and this matters. We are currently in a race between getting the vaccines and the variants of concern. The modeling of some of these variants show projections that could overwhelm our healthcare systems in the coming months. If that happens, there are some who are worried that the Healthcare Consent Act of Ontario could potentially be suspended in order for doctors to quickly prioritize treatment. While there are several questions about how that could work, so far there has not been a lot of public discussion about what that could mean. Does it only affect COVID patients? What about if you go to the hospital for an unrelated reason? Now, none of this is a given, and hopefully it doesn't come to pass, but Mariam, Shanouda, and Jessica DiMeneres are the lawyers at the Arch Disability Law Center. They have been monitoring the potential suspension of the HCCA and join us to discuss why they find that concerning. Thank you both for joining us.
Thanks for having us, Raju.
Thanks for having us.
Okay, guys, so here's the thing. I think not a lot of people actually know exactly what the Healthcare Consent Act of Ontario is, so let's just start with that. What is this act? What does it govern?
So the Healthcare Consent Act is a piece of legislation that governs sort of broadly decision-making rights when it comes to healthcare decisions. You know, it's our fundamental right as humans to make decisions about what happens to our bodies. And the Healthcare Consent Act says that we will not provide a treatment or will not have treatment withdrawn without consent from us or from the people who make decisions for us in the case that we don't have capacity to make decisions. And, you know, it's not an absolute right in the sense that if there is a dispute between, for example, my decision makers and the physician who is making recommendations about healthcare kind of treatment plans, in the event of disputes between those two interests, there is a body that is set up through the Healthcare Consent Act to kind of navigate those disputes. So it's a really important piece of legislation that sets out kind of the ground rules about making decisions about healthcare, kind of enshrining those fundamental rights, and then also enshrining this kind of checks and balances and review system in the event that, you know, there needs to be a decision made about a treatment plan and there is a disagreement.
Okay. Now, in terms of COVID-19, one of the reasons that you guys are sort of focused on this is that there's a possibility that this could be suspended if, say, intensive cares are overwhelmed. What do you see as sort of the fear and issues with that potentially happening?
There are many. I think our healthcare system right now in Ontario, really across Canada, I would say, is quite patient-centric. And the Healthcare Consent Act, which I'll refer to as the HCCA, the HCCA really enshrines that patient-centric mentality to healthcare. To now suspend certain provisions and suspend our right really to consent to the kind of treatment we expect to get when we go to the hospital is very problematic. In and of itself, it's problematic, but now the way in which it's happening is also problematic. There's a lot of lack of transparency. What we hear are backroom fodder, backroom discussions. This recommendation that was made by the bioethics table to the Ontario government, we didn't learn of except through reporters, aside from the fact that we were at the table with the bioethics table members a few times over the last year to express our concerns. So all of these things, the way in which it's happening is not out in the open. It should be out in the open. And to even contemplate suspending our right to consent to treatment is very, very problematic. I think we should be working towards making sure we don't get to that point rather than expending effort on suspending our right to consent to treatment.
Just to be clear, the reason to potentially suspend it would be in a case that the intensive care is sort of overwhelmed. Basically, our hospital system is just a giant mess. And I mean, I remember early on in the pandemic, there was a New York Times reporter who went on an interview thing and basically sort of was talking about in Italy, the situation where doctors would actually be like, okay, things are so bad that we've gotten to the point where, okay, I can take care of you, but not you. I can do this to you. You take too many resources. Is that really what the issue is from the medical community? How does the HCCA protect us from something like that right now?
So you're right. It would happen should we hit what's called a surge. So a surge is when, like you said, the ICU would be overwhelmed. At first, we were hearing from the medical community that the concern was lack of ventilators, lack of beds. Now we're also hearing that really what they're worried about is more like lack of staff, because as you can imagine, healthcare workers by this point are quite exhausted, as we can imagine. But I think there's a difference between us and what happened in Italy, which was, of course, horrific and unimaginable. We're about to celebrate the 1 year anniversary of COVID. And what happened in Italy happened so early on that you can empathize for why they were unprepared for that surge, hitting surge much quicker, much earlier on. That's not where we are right now. We are about to maybe, hopefully not, but maybe enter the third wave in April. That means we've had 12 months and 2 waves that we've made it through to consider how we don't get to surge and to have to make decisions like you get a bed or you get to see a physician and you don't. Like Jessica said, the Healthcare Consent Act has a checks and balances system in so that when there is disagreement between physician and patient or physician and patient's family, it is incumbent, the burden's on the doctor to get that decision reviewed, not on the patient or on the family. And I think that tells us a lot about what the HCCA holds dear, which again, it's patient-centric. You as the patient have the right, or I'll use this word colloquially, the presumption to have the decision to what treatment you can consent or cannot consent to. When we suspend the HCCA, we not only suspend this fundamental value of consent to what happens to our bodies, but also suspending that checks and balances system, which no document currently that's distributed to the hospital has or replaces or substitutes. So we're not only negating consent, we're then also canceling out any checks and balances system. Where is the accountability? Who's making these decisions? How are these decisions being made? And I believe that all Ontarians and Canadians, most of them at least, believe that we should know these answers and should be privy to that information.
I think the other question here is, now, does this affect only people who are dealing with symptoms from COVID? Or one of the reasons that we want to talk to you is that we saw a warning from the Ontario Doulas Network. So, what if someone has no COVID symptoms and is just going to the hospital to have a baby and the HCCA gets suspended? Are they covered in this? Or, how does it affect something like that?
I think one of the major question marks and one of the biggest problems, I mean, there are many, as Mariam has discussed, but one of them is we don't really know what it's going to include. And one thing that I was going to add to Mariam's last comments was that we're doing our best with the information that is publicly available at this point. So, but we don't know for sure that these are the provisions that are being contemplated for suspension. We know that the intention behind seeking a suspension is to give powers to doctors to make these decisions without having to go through the checks and balances. We know that that's generally the intention, but again, we don't know exactly which provisions, and we don't know kind of exactly the scope of the suspension and kind of how that will impact other people in the hospital. The other thing I wanted to add to what Mariam was saying is just the context that this is being contemplated or potentially being sought is to be sort of a companion piece to the triage protocol and the triage policies that are potentially going to be helping doctors make decisions in an event of surge. And so as we understand it now, there's almost like 2 versions of those directions. One being if the HCCA is not suspended, so essentially triaging, but also respecting the rights that are set up in the HCCA. And then this other version, which kind of has these additional powers with the HCCA suspended. So I think it was important to kind of explain that that's how it's situated in sort of the pandemic triage plan.
We'll be right back. You mentioned that there's sort of a lack of transparency and it's been hard to get information. I'd like to hear about that, because then my next question is where are we with this right now?
Jess and I are lawyers, but we've had to don investigator or sleuthing hats for the last year because certain tables that have been struck by the government have not been as transparent or as free flowing with their information as we think they should be. So the first whiff that we got that this might be contemplated or might be recommended to the government was back in December when the bioethics table provided us with a 36-page document called Proposed Framework. And this proposed framework had several recommendations that they had already made to the government back in September. So 4 months after they had already made this recommendation, we then get kind of here's a little piece, a crumb of information for you. And even then, this recommendation was very vague when it came to the potential suspension. To paraphrase, it said that it should be contemplated that doctors be able to deviate from the HCCA via an emergency order. That raises several questions. What kind of deviation? What provisions do you want suspended? How are you going to suspend them? How are you going to reach this decision? And pursuant to what legislation are you going to make this order? Because if you're asking for an order, you can't just ask for an order. The way law works is it has to be attached to some kind of act. We got this very late in December, and then early in January, a National Post reporter reached out to us and said this recommendation had actually been made, and specifically to allow doctors to withdraw treatment without needing the consent. Then we started to dig a little bit more. We found a webinar that was held by the Critical Care Society of Ontario, the CCSO, where some of the people who were proponents of this recommendation spoke very freely about it to their colleagues in the medical profession and said, this is being contemplated. This is a recommendation that we endorse. And should it be granted, then we will have a triage protocol that contemplates how doctors should be making decisions without needing consent. However, if not granted, and for the time being, there's a document called the Emergency Standard of Care that tells doctors how to act or how to make decisions should there be a surge. About this emergency standard of care, it's dated January 13th. It has never been made public by the government, has never been made public by bioethics table or the Critical Care Command Center. It has been made public by ARCH. It has been made public by the AOD Alliance. And I believe one other organization has made it public because we believe that we should all know what is going to happen should we end up in hospital during COVID. Where are we at now? I think that's a great question that we're all asking. We have some intel to say that because Ontario is currently out of the second wave, we're in, again, a bit of a lull. There is less likelihood that we'll be hitting surge, meaning less likelihood that we would need such a suspension, or doctors would be heavily seeking a suspension. But to us, that means that we need to really consider this now prior to a third wave where panic might ensue and we're again back in the same conversation. I do want to say that we've heard from doctors, a lot of doctors who are not endorsing this, who are not supportive of this, who do not want to be making decisions without consent of patients. And as a non-medical personnel, that gives me some kind of comfort that there are some medical professionals out there who do not want to provide healthcare without the consent of a patient.
Now, I would expect that there would be a number of medical professionals who would say that this is something that would be necessary just for speed. And I mean, let's go for the old cliche. Doctor knows best. How do you respond to that?
With all respect, I have a lot of respect for doctors and all healthcare professionals, but from a disability perspective, the cliche doctor knows best would come heavily under fire because that hasn't been the experience of persons with disabilities in Ontario. Persons with disabilities, the way they view themselves, the way they view their disabilities, the way they view their value and the quality of their life has often been in tension with medical care professionals. And we know that there are Supreme Court cases that speak to that. I completely understand the horrible situation that nobody wants to end up in where they have to be making these decisions. But I think we have to be very careful when we approach this idea of efficiency should trump human rights, or all-out safety can trump human rights, without contemplating what that means for us as a society and what that means for us going into the future. If we don't protect human rights now, in the times of emergency, in the times of war, in the times of a pandemic, then what do human rights mean then? It's so easy to value and to respect each other's human rights and to respect the principle of non-discrimination when we're not in a scary time or a time of pandemic. But it's most important to respect these values and these rights when we are in such a scary time, for lack of a better term, really. So I understand the efficiency argument. Do I think it justifies our right to consent? Does it justify the right to be free from discrimination or to violate the freedom of discrimination? No, I don't think so.
The other thing I would just add to that is that I think what's really important about the HCCA is that it's not an absolute right to make the final decision about care. Like, I think patients and physicians come head to head. Unfortunately, it happens in non-pandemic times, in non-dire times. People come head to head with kind of what the doctor is saying would actually be beneficial for this patient. And so I think keeping in mind that we have this mechanism, I mean, it's not perfect, especially from a disability perspective. There's all sorts of issues about the consent and capacity board we don't need to get into for the purposes of this podcast, but just that we do have this mechanism in place. And it has experience in these matters. And it's also, to some degree, designed to be a very quick avenue, quick process, because they recognize that they're dealing with often end of life decisions. And they don't have a lot of time. So I just think it's important to kind of think about that we have this mechanism available, and we should be thinking about kind of what can we do with this mechanism that we have in place, rather than just the inclination be to just suspend it. I think that the balance between those two things is concerning.
Is there anything that I didn't ask that you think that our listeners should know?
If you want, you could advise people that we do have a summary advice and referral service. So if someone's looking for more information on this issue, they must be a person with a disability living in Ontario, because that's what our clinic is for. They can always check out our website, and our contact information is there should they want to speak to someone further on this issue.
And then also just kind of, I think, emphasizing that we don't want to incite panic. So inciting that, there's still a lot of question marks. It's not in place right now. And that we're kind of doing everything we can to make it public, to make as much information as we possibly can public, so that it is kind of part of the open discourse. But doing that in a way that doesn't incite panic, I think, is another emphasis generally for our comments.
Okay, well, I think you guys have been quite informative, and I really, really appreciate your time today. Thank you.
Thank you so much.
Thank you.
Mariam Shanouda and Jessica DeMoneris are lawyers at the Arch Disability Law Center. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.